We're going to show you what we use for ear cropping once the vet has cropped your dog's ears, which should be done by the time it's no older than 10 to 12 weeks. We use a pipe foam that's available at any Home Depot or Lowe's or Home Improvement Center. This is a soft foam, styrofoam insulation. Get a good look at it. It's about 3/4 inches inside. I start out by cutting about a 4-inch length of the foam into a tube, and then I'll cut that tube directly in half. Pair of scissors. You wind up with a slice like this, half moon, halfway around. This is what's going to go into the dog's ear, but we shape this to fit in the contour of the dog's ear. How we do that is by simply taking a pair of scissors and notch out the piece of foam like so, leaving about 1 inch on the bottom, tapered outward a little bit. This is about 1 inch long, this tab. And then the top we just cut off a little bit of on both sides, so it's pretty much almost like a triangle. A little blunt at the top, the ear will stick out. And then we use a silk medical tape, because it doesn't have a lot of adhesive, so it won't pull the dog's hair off their ears when you take it off. It's pretty thin tape, but this medical tape stays on pretty good. Once you have that piece cut, let's see if we can use somebody to demonstrate. Heidi's ears were done like that. She's about 3 years old now. Hers were done the same way, and you can see they're standing up beautiful. Augustus' ears were done about 2 weeks ago, and his are still taped up. Doesn't seem to really be bothering him at all. Of course, they're wrapped with the medical tape. That'll stay on. Really, you want to leave it on for about a month. I would take it off in a week, maybe 2 weeks, just to clean the ears and then retape it and make sure the foam is down in there and the ears are wrapped around the foam. Once this goes in, you want to wrap their ear around the foam and then tape it up, starting from the top. I don't know if Heidi's gonna appreciate this, but let's show. So with the tab, should be facing the head. You don't want it facing outward. If it's going to go into this ear, then you want the tab going into the ear canal towards her head. And this will go down into the ear canal, and you'll push it down in as far as it'll go, and then wrap the ear around the foam on both sides, wrap it around it, and then you'll start from the top, taping it up. And as you can see, the foam is pretty much shaped just like the ear is. And if it it can bend rather than a rigid tube. This can bend, so it's more comfortable for them. You don't seem to mind, do you, girl? No, we don't want to eat it though. Now for the other side of her head, you would turn it the other way. You want the tab facing inward, so it'll go into the ear and down into the canal. You want to push this down into the canal pretty far so it doesn't pop out. So push it down. Like I said, you're leaving about a little more than 1 inch on this tab, so when you push it in, it don't keep popping out of her ear, and it'll stay in there. Here's the ear canal. Just push that down into the ear canal. You see, the foam is pretty much staying in there on its own now. It's inside her ear. And you'll wrap the ear around the foam, because you want it to be curled around the foam. So start the tape on the outside and pull it around so that the ear stays rounded. Okay? And there you have your ear cropping tip with a piece of foam. Cut to pretty much the shape of the ear, and like I said, this inch will go down into the ear canal. It's rounded, and you wrap the ear around the foam and just wrap the tape around it good and tight, but make sure this is down in as far as it'll go in the ear. This will go into the inside, and then of course another one on this side, one on both sides. There you have it. Good luck.